how to understand the Nidana of Pitta Kapha dominant diseases, how to interpret the Pitta Kapha dominant diseases etiological factors. This is the topic of discussion in this particular video. Dear ANA community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. Whenever we speak of the Nidana of Pitta Kapha dominant diseases, it is being mentioned in Ashtanga Hridaya, that is Dvandvantu Sankarat. So that means the dual dosha vitiation may be possible because of the exposure to the increase of the because of the exposure to the Nidana, which increase the dual dosha. In this particular occasion, Pitta as well as Kapha dosha in the body. The textbook says, Pittam Katvam Latikshnoshna Patukroda Vidahibihi Sharan Madhyana Ratri Artha Vidaha Samayeshucha. These are the Nidana which are considered to be responsible for the increase of the Pitta dosha in the body. Swadvam Lavana Snigdha Kurvabishandi Shitalaihi Asya Swapna Sukhajirna Diva Swapnati Brahmanaihi Prachardhanadya Yogena Bhuktamatra Vasantayohu Purvanne Purvaratre Shleshma. These are the Nidana, they are considered to be responsible for the abnormal increase of the Kapha dosha. When you speak in terms of the Dvandva dosha prakopa, here Pitta and Kapha dominant diseases are concerned. Permutations and combinations of one, two, or more Nidana which increase Pitta dosha in the body, and permutations and combinations of one or two or more Kapha increasing Nidana. A person is exposed simultaneously at a particular time, then there may be the possibility of the Pitta Kapha dominant diseases in the body. For example, if the person is exposed to Katu Rasa Ahara and Swadu Ahara, then there may be a possibility of Pitta Kapha dosha increase in the body. If the person is exposed to Katu, Amla Rasa Yukta Ahara and Guru Ahara, there may be the possibility of the Pitta Kapha dominant disease manifestation in the body. If the person is exposed to Katu, Amla Rasa Yukta Ahara and Abhishyandi and Shitala Ahara, then there may be a possibility of Pitta Kapha dominant disease manifestation in the body. If the person is exposed to the Divaswapna and Amla Lavana Rasa Yukta Ahara, then there may be a possibility of Pitta Kapha dominant disease in the body. If the person is doing the Ati Brahmana and he is consuming Vidahi Ahara, then there may be a possibility of the manifestation Pitta Kapha dominant disease. If the person is consuming the substances, that is Swadu, Amla, Lavana Rasakta Ahara in Madhyaratri, etc., there may be a possibility of Pitta Kapha dosha increase in the body. In that way, either if there is the permutations and combinations of one or two or more related to the Pitta or Kapha, Pitta and Kapha increasing Nidana, there may be the possibility of the manifestation of a Pitta Kapha dominant disease. We are going to learn these with different examples. Before knowing into the examples, three key factors that we need to remember in analyzing the Nidana as such. That is what we can say this SNV of Nidana as such, or SNV of pathogen. So here the term S refers to source. Source, that is the source of entry of the pathogens taking place into the body. 9 orifices are being mentioned in the males and 12 orifices are mentioned in the females. There may be the possibility of entry of pathogens that may take place either in 1, 2 or more natural orifices. We have to identify which particular natural orifice the person is having the exposure of a pathogen is going to take place. Second major point, that is number of pathogens entering into the body. Naturally, the less number of pathogens will be leading to less manifestation of the disease as such. More number of pathogens, more severe manifestation of disease that may take place. Third major point, that is virulence of the pathogens entering into the body. If the person is having the entry of a less virulent pathogen, then obviously the person may have less severe disease. Whereas the person, if he is exposed to more virulent pathogen, then the person may likely to have more severe manifestation of a disease. Whenever if you are looking into the etiological factor, try to identify the SNV of pathogens as such. Then only we can able to analyze these Nidana accurately regarding the different examples. So here there is a story of a fox and crane. In the childhood we were learning about this particular story itself regarding the Pitta and Kapha dominant disease, how this is maybe possible here. So it is on one particular fine day, fox and crane, they were both friends. On fine day, the fox actually invited crane to have the lunch. That too, it is the madhyana as such. It is considered to be pitta prakopaka kala. At that particular time, the fox started to give the dish in the plate. That is the plate as such, which is having the madhura guru rasa yukta ahara there. So, as it is considered to be the plate, it is difficult for the crane to have the consumption of this particular food substance as such. Because of that particular reason, what the fox does is that takes the food from its plate and the plate of the crane also. In that way, the main thing so here, that is the snigdha guna of this Guru Madhura Rasa Ahara. So that is actually responsible for the abnormal increase of Pitta as well as Kapha Dosha in the body. Because Snigdha Guna is a common quality or Guna which is being present in the Pitta as well as Kapha Dosha there. Hence, we are going to expect the increase of Pitta and Kapha specifically in the alimentary canal compartment or GIT or gastrointestinal tract as such. Let me take another example. Tekshna ahara and Shita ahara. So whenever a person is going to consume this together, there may be the possibility of Pitta as well as Kapha dosha in the body. Whenever the person is going to consume the number of samosa more than ice cream, then the person may have the abnormal increase of Pitta rather than Kapha. If the person is going to consume more amount of the ice cream than samosa, then there may be the possibility of abnormal increase of the kapha, and to a lesser extent there may be abnormal increase of pitta. In that way, the content of samosa and ice cream will determine the increase of pitta kapha dosha or increase of kapha or pitta dosha in the body. Let us take another example. Eating ice cream while seeing the movie. Madhyana and Ati Brahmana and Madhura Rasa Sevan. As it is being mentioned, the noon time is considered to be the natural time period for the increase of the Pitta dosha. If the person is going to consume the ice cream rather than the food substances, then there may be the possibility of the exposure to Shita and Snigdha guna in the body. Thereby, there may be the possibility of Shita and Snigdha guna increase in the body, which in turn leads to the abnormal increase of the Kapha dosha, and the noon time that is considered to be the responsible factor for the abnormal increase of Pitta dosha. So here there may be the possibility of the abnormal increase of Kapha as well as Pitta dosha in the body. Drinking the milk and buttermilk. So here Vyas and the Amla and Labana Rasa Yukta Sevana, let us say. This example, it is the lady who is considered to be having the 20 years of age group. By nature, it is considered to be the Kapha dosha increase in the body. Whenever the person is going to consume 100 ml of buttermilk with 1 chili and 2 pinches of salt, there may be the abnormal increase of the Pitta dosha in the body. But if the lady is going to consume more amount of the buttermilk with adding with more amount of the chili and salt, the degree of Pitta dosha vitiation will be much more. So in this way, we are going to expect abnormal increase of Pitta as well as Kapha dosha in the body. Regarding the consumption of samosa after having the daytime sleep, that is Diva Swapna and Katu Amla Rasa Sevana and Lavana Rasa Sevana. So daytime sleep, that will be responsible for the abnormal increase of the kapha dosha in the body, and the samosa consumption, that will lead to the abnormal increase of the pitta dosha in the body. In this way, if the depending upon the nature of the nidana sevana, there may be the possibility of abnormal increase of pitta kapha dosha or kapha pitta dosha in the body. Regarding the eating samosa at 3 p.m. by a 20-year-old lady. So here that is considered to be Vyas and Katu Amla and Lavana Rasa Sevana. So here there may be the possibility of a abnormal increase of Kapha and Pitta in the alimentary canal. So in this way the analysis has to be done. First of all, how to identify the Nidana as such. That is, we have to identify based on the various abnormal patterns that are observed in an individual, that has to be known. How to identify the abnormal patterns? We can able to identify by knowing about the timing of manifestation of symptom. Which particular symptom has been manifested first? Which symptom manifested next? Which symptom manifested later? Depending upon the nature of the chronology of the symptoms, we can able to do the SNV of pathogen analysis. S refers to source of the pathogen, N refers to number of pathogen, and V refers to virulence of pathogen. Analysis has to be done. And based on that, you have to identify the dosha vitiation, which has to be linked to the symptom development. Then only we can able to analyze the dual dosha prakopa in the body. To sum up, whenever if you are analyzing the nidana of the Dvandva dosha prakopa, that too Pitta Kapha dosha as such, we have to know about the SNB pathogen analysis has to be done. So there may be the possibility of abnormal in the exposure to any one, two or more etiological factors related to Pitta Prakopa, and there may be the possibility any one, two or more factors related to Kapha Prakopa exposure that will be observed, which will be leading to the manifestation of Pitta Kapha dominant disease. So thus, whenever if you are analyzing the Dvandva dosha prakopa, we have to analyze the overall situation exposed by an individual while getting the clinical manifestation. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you would like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.